Hello there. Thanks for tuning in to the Highmark Health Options Health Awareness Series. We're glad you're here. Today, we're going to talk about one of the complications of diabetes, diabetic retinopathy, which is another way of saying how diabetes can affect your vision. This is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions or concerns you have about your health. Here are the topics we will cover. What is diabetic retinopathy? What are the symptoms of diabetic retinopathy? How is diabetic retinopathy treated? How can you prevent diabetic retinopathy? Let's go ahead and get started. What is diabetic retinopathy? Diabetic retinopathy occurs when high blood glucose levels damage the blood vessels of the light-sensitive tissue at the back of the eye. Diabetic retinopathy is the most common and serious type of eye problem associated with diabetes, and it is the leading cause of preventable blindness. In addition to diabetic retinopathy, there are other types of vision loss that people with diabetes may experience. Usually associated with age, cataracts are more common and occur earlier in people diagnosed with diabetes. With cataracts, the lens in your eye becomes cloudy due to the breakdown of proteins in the lens. Diabetic macular edema is when the tiny blood vessels in the retina leak fluid, which builds up and causes swelling. This distorts vision and may lead to permanent vision loss. Glaucoma is an eye disease that causes damage to your optic nerve, resulting in irreversible vision loss, and is more common in people with diabetes. This is why annual dilated eye exams are very important. These exams are part of your Highmark Health Option vision benefits. What are the symptoms of diabetic retinopathy? Many people do not show symptoms of diabetic retinopathy. However, here are some things to be aware of: blurred vision, dark or empty areas of vision, distorted vision, impaired colors, seeing spots or floaters, and vision loss. How do you treat diabetic retinopathy? There are several ways to treat diabetic retinopathy. We are going to talk about 3 of them. The first treatment is injectable medications. These medications are injected in an in-office procedure into the middle of your eye, which may help to stop the growth of new blood vessels. It sounds a lot scarier than it actually is. It is a quick procedure, and the injection is barely felt because your eye is numb. Another treatment is laser therapy. This in-office procedure seems scary as well, but it is as easy and as painless as a routine eye exam. Don't worry, most of the time spent in office is waiting for the numbing and dilation drops to do their job. There are 2 options for laser therapy. The first is focal laser treatment. This treatment can stop or slow blood and fluid leakage into the eye. The second is scatter laser treatment. This treatment can shrink abnormal blood vessels in the eye. The third treatment is called a vitrectomy. This procedure, which is performed in a surgery center or hospital, involves making a tiny incision in your eye to remove blood from the vitreous, as well as scar tissue that's tugging on the retina. This procedure is performed under a local or general anesthesia. So how can you prevent diabetic retinopathy? Some diabetic eye diseases have no signs or symptoms until they are too obvious to ignore. The best thing you can do for yourself: get a dilated eye exam every year. This will allow for a more thorough eye exam, and it will catch conditions early before permanent damage, including vision loss, is done. As a reminder, these vision exams are covered by your medical benefit. Make sure to take full advantage of this. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch other episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.